and it's if we define someone who has taken a lot of acetaminophen and overdose, what do they call it? I've quite forgotten. If we have acetaminophen poisoning, there's a drug we give to alter it back. Forgotten how it is. I think I remember very well, but there is a problem with acetaminophen poisoning. So we say tramadol may be used for patients unless precluded because of the history of seizures. In patients presenting with a then we go. So if it is me, I can first choose an NSAID for 1 month, and I see how the patient is as I'm monitoring him. We monitor the blood pressure, what, then maybe I can switch to tramadol, because if you have chronic kidney disease, then you have to choose tramadol or intra-articular injections. Are you getting it? Because we talked about NSAIDs causing a problem to the kidney. So if someone already has a problem with the kidney, then you cannot give an NSAID, because they inhibit renal prostaglandins, which reduce the glomerular filtration rate, further causing damage to the kidney. So tramadol, but there's a challenge which comes in, as I've said. If this patient has history of seizures, maybe because tramadol causes constipation. Are you getting it? History of chronic constipation, seizures, I know hypertension, I know obuzibu cooking, I know obuzibu ku liver, I know ulcers, are you getting it? So you have to find a way how you put it, but you have to weigh the risk and benefit to know that I may choose this. If has the heart failure, I'm not going to choose an NSAID. Has kidney, I'm going to choose tramadol. Are you getting it? But in a long run, someone may have constipation. So what do? You give something that takes out the constipation. That's why these people combine. You give psychosis, PPI, Gugun, that's good. Are you getting it? Because you have no choice. It is that you have to treat. So that's a challenge. So this work was trying to show how NSAID increases the cardiovascular risk. Are you getting it? For prostaglandin synthesis inhibitor, they work by reducing inflammation and inhibit production of cycloogenase, fluid retention, exacerbation of heart failure. Are you getting it? They can destabilize and worsen pre-existing heart failure, especially in patients with a history of cardiovascular disease. Are you getting it? So it's up to you to choose. I think I've explained very well how you can intertwine these things. So because of time, let me leave. Patients with low cardiovascular risk, high. Patients with low cardiovascular risk and moderate or high risk for GI bleeding, recommendation once daily celecoxib, 1 NSAID plus a PPI. High risk cardiovascular event, consider use of tramadol or naproxen with careful monitoring of the blood pressure and renal function. Are you getting it? That's how it is. Tramadol and opioids, if with NSAID use there is increased liver functional tests, you have to discontinue the trial of tramadol is initiated. If there is a history of seizures or receiving medication with teratogenic activity, those antidepressants, what about the antidepressants? Then a tramadol, so you play it the other way around. I don't know that people are getting how I'm trying to. Are you getting it? It's all about choosing these NSAIDs and these painkillers. It's what I'm concentrating on. How are you choosing them? Because you're treating something for a long time. So after that, maybe for after 2 months, we have got the intra-articular therapy. I think we have it there. The triamcinolone or methylprednisolone with lidocaine, 1%. Has been effective for approximately 4 to 8 weeks. Like maybe after 4 weeks, injection after 4 weeks, but there's a challenge. There's a client who was coming every after 2 weeks up there. I didn't understand how possible it was. We have to limit. We don't have to give, because they encourage these intratitular injections be given like 4 times in a year. Are you getting it? Like 4 times in a year. But there was someone who was coming after 2 weeks. But I think I'll go back and see why this patient was receiving triamcinolone every after 2 weeks. So that's why they're saying intratitular glucocorticoids are given no more than frequently than every 3 months. That culminates to 4 times a year. Are you getting it? That's how it is. There is that intratitular injection of hyaluronic acid supplement, which tends to be more effective and provides sustained clinical effects than the intratitular injections of glucocorticoids. So we have that hyaluronic acid injection. Remember, it is a component of the cartilage. So the dietary supplements we have, there are some patients who are intolerable to side effects on prescription or multiple drug failure. Omwadde ebidagala bingi biki omuteekako also to some supplements. Are you getting it? Drugs such as glucosamine, chondroitin, however, they are not only effective in reducing the pain and sometimes may contribute to daily pill burden and expenses. So jabiwa, but video just why? But you give because it is that, because they are just components of the cartilage. So the glucosamine is produced naturally in the body and it is used in building the cartilage. Remember, we said osteoarthritis is due to cartilage damage. And we give glucosamine to rebuild up that cartilage. Are you getting it? That thing that cushions the joints. So chondroitin is a component of the cartilage and plays an important role in the elasticity and the function of the cartilage. We need those glycosaminoglycans. They play that important role. Yes, they do load bearing and lubricating properties. They are called glycosaminoglycans. They are components. You have to know what that cartilage has. The cartilage matrix has chondrocytes, which I've talked about. They are the ones which maintain and repair or produce the cartilage matrix. We have the certain type of collagen, which is there. They talked about it in pathogenesis. That's how it is. So I've just picked a few products that were at Zest and how we are supposed to use. But I think the most that I liked was the Ricat. Ricat has ingredients that are nice. It has collagen peptides. And this collagen is hydrolyzable. Are you getting it? It is hydrolyzed collagen, meaning it can easily break down and easily absorbed. It goes to gundi. Remember, we talked about the components of the cartilage. It must have the collagen. It must have the proteoglycans, which are the glucosamine, which are the chondroitin and hyaluronic acid. So you find that in Ricat, we have collagen peptides, we have glucosamine, we have chondroitin in it. We have natural extracts which are anti-inflammatory in nature, like Boswellia serrati. Curcumin is also there. They have anti-inflammatory, so that will help with the pain and inflammation. The other will help in rebuilding the cartilage. Are you getting it? They have also omega-3 fatty acids, which decreases inflammatory mediators and also increases what we call adiponectin levels. It is a protein which plays a role in adiponectin. I think people go and read more about it, but it's a protein. It's associated with increased insulin sensitivity. It also plays a role in fatty acid breakdown, something like that, which I've forgotten. They also have minerals and vitamins. D3, C, folic acid, B12. Are you getting it? Because remember, when you're giving these the glucocorticoids, are you getting it? Those intratitular, what? Those long-term, they bring about long-term effects of osteoporosis. Are you getting it? So how to subdue about that? You have to give vitamin D3 supplements. So you find that Ricat has collagen, glucosamine, chondroitin, which is what the cartilage is composed of. It is a nutritional supplement for people with joint health issues who also want to maintain health and mobility. So it is a once daily capsule. We have to, each of it is 2,005. And so sorry, I've liked Ricat because it has all what I need. You may add on the anti-inflammatory, what those enzymes and what, but has those natural extracts. They were well studied, especially at Boswellia serrati. It has anti-inflammatory properties. So you can be giving Ricat. It is very good. You have to maintain joint health in those who engage in activities. So it's not only given to those patients who are already sick. Those ones who engage in active sports of running, cycling, they can be taking also the Ricat. Ricat, it is there. It is 2,500 per gundi. Are you getting it? Yes, but you have to warn the patients of diarrhea, because in the first 2 weeks brings about severe diarrhea, by the way. But also has some constipation elements, dark stools, but those side effects subside with time. Are you getting it? But diarrhea is the most significant of Ricat. So another one, Nemolix C. Nemolix C, we used to have them whereby each was 2,000. Nemolix, and it was one I used to give. Now for Nemolix C, they combine eggshell membrane, which is rich in proteins such as the collagen we need. When you can imagine, someone just went there, studied studied about the eggshell membrane, aqua membrane now, and start making drugs over there. You can, if you're a pharmacist, and you can borrow a leaf from there, because these people keep repeating themselves. They just got the eggshell membrane. When again, asthmatic properties, there's that eggshell membrane. Namanya that mulimu glycosaminoglycans, mulimu certain collagens which will help. Are you getting it in rebuilding the cartilage? So if you're found, you can think about Nememinogamba Katinze, because this guy used natural extracts. It also has natural extracts of Boswellia. Even Ricat has a natural extract of Boswellia serrati. Even Nemolix C has Boswellia. It also has turmeric. They are all used in inflammation. So you can be there and maybe think, if I can do the eggshell membrane, maybe I add something which is something different, such that I quite be different from Nemolix C. We normally have it. So it's a 1 capsule daily. It's 2,000. We have cartilamine. That one doesn't. It just has glucosamine, which is just important in the production of those glycoaminoglycans. We need it. The chondroitin, and we also have the chondroitin itself. We have Uniortho tablets. They are just used in osteoarthritis, but this one is more of a painkiller. Actually, when you look at the insides, I didn't study much about Uniortho, but if someone has side effects of NSAIDs, would I turn to Uniortho, which is an inhibitor of the COX and LOX pathway to prevent production of prostaglandins, which are mediators of pain? So it has some flavonoids there, which have anti-inflammatory properties. If you read about the process of pain mediation, you find that COX, LOX, what, they come in there and they target those enzymes, the cyclooxygenase, the epoxygenase. That's what Uniortho has. I've forgotten the price of Uniortho. It is also there. We have OsteoCure tablets, 1 to 2 tablets per day, 1,800. But for it has glucosamine, sulfate, potassium chloride. Are you getting it? Now, the glucosamine was combined with potassium chloride, and that's where the problem comes. If we go and read about Naflam, they're giving for Naflam, it also has glucosamine, sulfate, potassium chloride. They combined glucosamine and potassium. So within the glucosamine, sulfate, potassium chloride, we have glucosamine, which is 500 milligrams, and then the potassium chloride, which is 167. So you combine the 500 and the 167 to give us the 667. Are you getting it? But they are saying if you have a kidney problem or you are taking heart or blood pressure medications, please first consult the doctor because of the potassium there. So you may find someone is on potassium sparing medication, and maybe when you check his potassium levels are high, they're above. Potassium is hyperkalemia is bad. Are you getting it? So when you decide to initiate giving Naflam, you have to be careful because of that potassium which is there. I'm sorry, I've not yet gone why they are combining glucosamine with potassium. Maybe to improve absorption, but I'll find out why. Maybe it's the salt form of it, but why would it be? Because we have the sulfate on it. But I'll find out why they're combining glucosamine with potassium chloride. We have the shark chondroitin. Why the chondroitin? They get it from the shark. That one, they bring it and they add it. That's how they make products. So imagine Naflam.